read from a book. And if you have to use mobile, you have to follow certain rules that every 20 minutes, take a break of few seconds, 15, 20 seconds, close your eyes. A book print consists of white and black ink.
Yes.
So that doesn't harm your eyes. But these electronic gadgets, the screen of them is made up of millions of small light emitting diodes, LEDs.
Okay.
And the light which is emitted from these LEDs, light emitted diodes, it's extremely harmful for your eyes.
Hello and welcome. You're watching GK Podcasts and I'm your host Shireen Aman. It's an honor to begin 2025 with a special guest today, whose expertise has shaped the field of ophthalmology. As we start the new year, there's no better time to discuss the importance of vision health. Join us today as we explore the advancements in eye care, essential tips to protect our eyesight, and the evolving field of ophthalmology. Please welcome Dr. Khurshid Ahmad, a true pioneer in his field. So it's my pleasure to have you here today.
Thank you, ma'am.
Sir, your career has spanned for almost over 50 years now. Please take us a bit down the memory lane and tell us something about your evolving journey.
Ma'am, I was born in Srinagar, brought up here. I did my initial schooling from Tandil Business School, went to SP College and passed my MBBS exam in 1990 from Government Medical College, Srinagar. Okay. Thereafter, I completed my post-graduation also from Government Medical College, Srinagar. And then I went to Chennai, where I did a couple of phaco fellowships. Phaco is that today we remove the cataract by making a very small incision without any stitches. It's the most modern technology. So I was trained in doing that, and I was probably the first from the valley to do that. And similarly, I stayed back there, did another fellowship in the diseases of the retina. We are seeing a lot of diabetic retinopathy patients here. So I trained how to diagnose such conditions, how to treat them conditions. Thereafter, I worked for the government for about 4 to 5 years, during which my main job, I was in charge of a mobile eye unit of the Directorate of Health Services.
All right.
And I must have conducted eye camps all over the valley. And I was there for about 4 years. We conducted more than 50 camps. And these camps were not just the camps where we would go and see the patients and tell them what they have. No. Their treatment, be it their surgery, be it their medicines, everything was done through the government free of cost. Okay. So that's after that, in 2004, my father, late Dr. Manzoor Saab, he passed away. He himself was an ophthalmologist of great repute. So when he passed away, I had no other choice but to step in his footsteps, and I had to be full-time in charge of Dr. Manzoor Eye Care Centre, where I am working right now from 2004 onwards.
So your father has left an indelible legacy in the eye specialty sector as well. I remember that he owned the very first eye specialty nursing home in Srinagar. He was the one who established it. Can you please tell us something about that?
My father returned in 1966 after passing his MS. He returned to the valley and he was appointed as an assistant professor in Government Medical College at the age of 25. So he started his own clinic by the name of Precision Eye Clinic, which was at Hazuri Bagh. Yes. That was where it was started in 1966. So that's what, then once we bought a new building at Wazir Bagh somewhere in 1995, we shifted there. We changed the name of the clinic to Valley Eye Hospital. But when he passed away, to dedicate the center to him, I changed the name to Dr. Manzoor Eye Care Centre.
Yes. So now that we have a very well-established Dr. Manzoor Eye Care Centre, you being there, you have been using the biotech Optiflex lenses for quite a long time now. What is its review and what's the purpose actually?
Ma'am, see, these lenses which you're talking about, they're basically intraocular lens. Cataract, as you know, is a very common condition, especially in old age. Now, there was once upon a time a cataract was removed and patients were prescribed very thick glasses, so which would not make their life same as it was before. Then gradually the lenses evolved, the cataract surgery evolved, and these days what we are doing is known as microphacoemulsification. Okay. We make a 2 millimeter incision into the eye. We remove the cataract by using high frequency ultrasonic waves. We suck it out through the 2 mm incision. Thereafter, we inject a lens, intraocular lens, through the same small incision into the eye, and patient is able to regain vision almost what he had 10 years back. And the best part is all this is done without any injection, without any stitches, and without putting a patch. That means patient comes, gets operated, 15 minutes. Thereafter, he goes home. He can even drive home if the other eye vision is okay. So the lenses which go into these eyes, intraocular lens, one of the best and most advanced lens is an Optiflex Genesis lens. This lens is made up of highly inert material which does not cause any reaction to the eye, being a foreign body. Despite being a foreign body, it does not cause any erosion. The optics of the lenses are so good. As I said, they give you excellent vision in all the conditions, that is bright light, dim light, night light, everywhere. And they have a blue blocker. The color of the lenses is slightly yellow. The yellow lenses, because here we see a lot of ultraviolet light in the sunlight as we live at an altitude. So this ultraviolet light is bad for your eyes. This lens has a UV blocking filter, so it filters the harmful blue light, and the eyes don't get damaged by that. So that's what about these optics.
So now that you have talked about the usage of these lenses, we are dealing with a lot of myths in Kashmir regarding the usage of lenses. People believe that it leads to vision loss, or someone says that it leads to thinning of your cornea. What's your take on that?
No, ma'am. These lenses are implanted into the eye. If implanted by the correct person through the correct technique, they do not cause any problem within the eye. In fact, I've seen patients, you get better vision than what you had with your own eyes without any lenses 10 years, 15 years, 20 years back. So this is a myth. I don't go by it. Apart from these Optiflex Genesis lenses, there are other types of lenses which we use in ophthalmology. One is a simple spectacle power level, what you have in your spectacles.
Yes.
There has been an advancement even in those lenses. Today we have lenses which are available here, which are made by the best companies in the world like Zeiss. Zeiss is the leader in optics. See microscopes, all these mobile phones, the best phones you have, they have a Zeiss lens. So those Zeiss lenses are available here. They are highly transparent. They are made up of material which is extremely light. They transmit almost 100% light, and they also have additional benefits that they come with what is known as a blue cut lens. Again, they cut the blue light, which is the harmful light for your eyes. And this blue light is usually emitted we use all these electronic gadgets these days, mobiles, tabs, computers.
It helps us to prevent the strain.
It helps us to prevent that.
Okay. So you now you have been dealing with lots of patients every day. What do you find to be the main cause of eye vision problems? Digital strain being the basic among them.
Yes. Digital today strain has reached a very alarming stage, even in our valley. The reason being, today you will see people at all, even a 1-year-old kid, the parents hand a mobile phone to him, watch games on that, and then adults, elderly people, everybody uses a smartphone or any other electronic gadget. Basically, if you are reading a book print consists of white and black ink.
Yes.
So that doesn't harm your eyes. But these electronic gadgets, the screen of them is made up of millions of small light-emitting diodes, LEDs. And the light which is emitted from these LEDs, light-emitted diodes, it's extremely harmful for your eyes, especially if you're using them without any protection, and especially for a longer time. What we have seen, patients, they often come, even if they said, no, whenever we look towards a screen or we are driving or doing our work, we don't feel like opening our eyes. We feel like keeping our eyes closed. Or sometimes the eyes become dry. We start blinking very frequently. So
even
some people have
headaches,
rubbing, headaches.
Yes.
So all these, what the people, then they start to rub your eyes.
Yes.
And if you're not able to open your eyes, you're not able to do your job. So my advice to people would be, Don't use these electronic gadgets day in and day out without any protection, and you have to use them. You should, but then take some breaks. Use them only when required. Wear a blue cut lens. There are so many students, they have a habit of now online classes. They're doing everything online. Even if they're not doing, they hardly read any books. They prefer to use these mobiles
From
and
advanced to senior citizens, everyone is inclined
So
towards
which is I advise them, I request them, please don't do that. As far as possible, read from a book. And if you have to use mobile, you have to follow certain rules, that every 20 minutes take a break of few seconds, 15-20 seconds, close your eyes, look towards a far off object one. Whenever you're doing work on electronic gadgets, AC, blowers, heating gadgets, cooling gadgets, they should not be put directly in front of you, because that leads to, already when we are using electronic gadgets, your blink rate falls, it becomes less. So the eyes are prone to get dry. And if you have any of these cooling or heating gadgets, the eye becomes, the dryness increases. Two, so similarly, they should work, but they have to maintain a good upright posture. People have a habit of reading in the bed, even when the room light is very dim, they switch off all the lights and then use these phones, which is not advisable, which is very harmful.
So now if we come to the eye vision healthcare for senior citizens, what do you think diabetes is the main cause, diabetic retinopathy, the concept lies there? Can you please tell us something about it?
Ma'am, two conditions, especially in our valley, which are highly prevalent, especially in the senior citizen group, hypertension and diabetes. And both directly they affect your eyes. Diabetes, yes, what happens in diabetes? The blood vessels, fine blood vessels in the retina where the image is formed, gradually those blood vessels, they start to shrink. So because of that, enough blood doesn't reach those areas where it should. So two things were developed because of that. One, that area becomes edematous, that is the area starts to swell. Once the swelling comes, patient usually is not able to read. One. Two, secondly, new blood vessels, which should not be there, they start to form, because the original blood vessels, they start to get closed, occluded. So new blood vessels start to form, which are not normal blood vessels, they start to bleed at some point of time, and which leads to a vitreous hemorrhage within the eye, and patients lose their eyesight. So for any diabetic, it is very important not to see an ophthalmologist when they have low vision, but to see when they have normal vision.
When it can be cured.
Yes. So diabetic retinopathy, unfortunately, cannot be cured. It can be treated, but treated if detected in time. So the best way to save your eye from diabetes is a regular eye checkup. That means if patient has, what I recommend, if patient is less than 5-year history of diabetes, I would recommend once in a year. Between 5 to 10, at least once in 6 months. More than 10, again, it should be more frequent depending upon whether the symptoms have started or not. And always, this is what I advocate to all the people who suffer from diabetes. Similarly, hypertension. Hypertension causes, again, the blood vessels which are inside your eye. The hypertension, because the blood has to be pumped at high pressure. So the walls of these blood vessels, they start to thicken. Once the wall thickens, the lumen of the blood vessels, the lumen becomes less narrowed. So less blood flows through these blood vessels. The blood vessel does burst, and there is hemorrhage within your eye. We call them as retinal vein occlusions. That's very common in winters also. Absolutely. So controlling your diabetes and seeking timely help, and preventive. Again, I would say preventive rather than see an ophthalmologist once a year. He will check whether you have started developing this, we call it as an hypertensive retinopathy. If yes, it can be treated. It can by way of modifying your lifestyle, lowering your BP by way of medicine, salt intake, restriction of salt intake, and regular exercise.
All right. So I have been seeing a lot of patients with an eye issue called glaucoma. What is it actually, and what are the preventive measures?
Glaucoma is a very serious eye disorder.
Okay.
We call it as a silent thief of vision. That is, it doesn't lead to any symptom, it doesn't lead to any pain. What actually happens, we have inside our eye, we have a fluid known as aqueous humor.
Okay.
If the fluid is not there, the eye will start to shrink. But this fluid, it forms. 24 hours it is formed, 24 hours it exits from the eye. Suppose this is a room and we have two doors in this room.
Yes.
One door through which the fluid enters your eye, and another door which is the exit door, it should exit through that.
Okay.
But the door should be of equal size. That means 1 liter will flow in, 1 liter will flow out.
Okay.
Your eye pressure, everybody has a pressure. Eye pressure, like your blood pressure.
Yes.
Ideally, it should be less than 20 millimeters of mercury.
Okay.
Anything beyond that is not good.
Okay.
So this can be kept only if the two doors are open equally. What happens sometimes, the exit door, it starts to narrow. So that what it leads to, suppose 1 liter of fluid enters the eye, only half a liter flows out. So that means 1.5 liter of fluid collects within the eye. This large amount of volume of fluid within the eye causes the eye pressure to increase.
Okay.
And what happens, suppose, okay, if eye pressure increases, what then? No, the higher the pressure, it will start to damage the optic nerve, which is the nerve responsible for our vision connecting from your eyeball to the brain.
Okay.
Damage to that nerve is usually irreversible. 10% is damaged, we can't do anything. We have to save the other 80-90%. So that is why it's a very serious issue, and it doesn't lead to usually any symptoms. Patient comes one fine morning, doctor, I can't see well, either with my that eye, or with my both eyes. And once we check the pressure, we see it's high.
It's quite high.
Once we do the test, we see, yes, he's not able to, his optic nerve is being damaged.
Okay.
So the best part, what are the reasons for these
Yes.
virus patient develop this condition? People over the age of 40, 45, they are at a risk. So any patient, whosoever he is, even if he has no other eye problem, after the age of 40, he should have once in a year ophthalmological checkup, during which the
And I think they should be aware once they reach this
should be
age.
checked. One.
Yes.
In our clinic, eye pressure is checked routinely.
Yes.
Whatever your age may be. You may be 10 years old, you may be 100 years old. It is checked
You need to go
routinely.
for
We do
follow-up.
not wait to the patient to tell whether he has high pressure or not. One. Two, if suppose patient has an eye injury, that can
Yes.
also cause the pressure to increase.
Yes.
Third, if you are on a steroids for a very long time, whether drops, steroid eye drops, or an oral steroids, that can also lead to a high pressure. Similarly, patient wearing high myopic number glasses,
Yes.
they are at a risk of developing this condition.
Okay.
In addition to that, there are other various features, patients who have hypertension. So it's better for everybody after the age of 40, once a year eye checkup, and during that checkup, eye pressure check should be mandatory.
Prevention is better than cure.
Glaucoma has no cure again.
Okay.
So it's better to prevent.
So now if I come to the future of ophthalmology, what new innovations and how evolved do you find your sphere in the upcoming years?
Ma'am, ophthalmology, I would say, of all the specialties in medicine, it is advancing at a very, very fast pace. What we were doing yesterday and what we are doing tomorrow, there's a hell of a difference between them.
Okay.
Every disease, firstly, the diagnosis has increased. Every condition. We have today advanced equipment like OCT, which can diagnose
Yes.
the condition like
Yes.
glaucoma at a very early age. Similarly, OCT, we can diagnose the macular edema, which we face in these patients of hypertension and diabetes. We can not only diagnose it at an early stage, we can also diagnose how much edema is there, whether our treatment is helping them. Similarly, there are other equipments, femtosecond laser is there. There are many more advances which are taking place. See the technology wise, that's what I'm saying. What we have seen today, cataract being one of the most important causes of curable blindness here. So the advances in cataract surgery are so much, the newer lenses, newer machines. Similarly, we have these conditions, as I said, hypertensive retinopathy, diabetic retinopathy. If we would see them up to a 5 year back, 10 years back, we could do very little about them. But today we have injections, we call them anti-VEGF injections. These injections we inject into the eye. And because of them, the edema comes down, the blood, the bleeding which is within the eye, it stops. So these injections have been a game changer in management of diabetic retinopathy, or there's a condition, age-related macular degeneration. Again, a very, very common, important cause of visual loss in an elderly age group. And unfortunately, again, the disease cannot be reversed. So earlier we diagnose, earlier we treat, the remaining vision can be saved. And these injections have become a game changer for them. So a lot of new things are coming, and the best thing is that in Kashmir, we are using all these things. We are in touch.
That's what I wanted to come up to, because people here don't trust their own facilities. They like to go to out of state for their post-operative care.
30-40 years back, there were very few centers or very few doctors in Kashmir who would be ophthalmologists, and equipment has to be imported all the way from foreign countries. So we did not have access to the most modern treatment, the diagnosis, equipments here. But now I can say with authority that in Kashmir, ophthalmology is highly advanced. No patient needs to travel to anywhere in the world for treatment. If it can be treated here, it will. If he's not being able to treat here, it will never be treated anywhere. Both our government hospitals, our private hospitals are doing very good job. Our doctors, our young ophthalmologists, they are trained. They go out, they get themselves trained, they come back and are doing excellent work. So this myth of going out, somebody has a strike and somebody advises at home, oh, why don't you take him to Delhi? Why don't you take him to Indore?
That's the biggest thing.
I don't think so that those things are required now. That era is over.
Thank you so much, sir, for equipping us with your wisdom and knowledge. And thank you for giving GK Podcast some of your precious times.
Thank you, ma'am.